We chose to do Alice in Wonderland. This movie shows many characters with mental health disorders. The different disorders possibly observed are Alice with schizophrenia, nightmare disorders, or dream anxiety disorder, and psychosis. The Mad Hatter possibly has bipolar disorder, post-traumatic stress disorder. Absalom the Calculator has a possible hallucinogen persisting perception disorder and grandiose disorder. The Queen of Hearts has a narcissistic personality disorder and a paranoid personality disorder. The White Rabbit has generalized anxiety disorder. The March Hare has Tourette's disorder and tic disorder.
Say.
Tweedledee and Tweedledum have ADD, which is a shared disorder between the twins. They both exhibit the same signs and symptoms. And then the Dormouse has intermittent explosive disorder.
Our movie starts with Alice laying on the bank with her sister who's reading a book. As she's laying on the bank, she sees a white rabbit go bouncing by, and she decides that she wants to follow the white rabbit. She follows the white rabbit for a while, and he goes down the rabbit hole, and she decides to investigate and consequently falls down the rabbit hole with him and ends up in Wonderland. After being on quite a journey in Wonderland, she meets Tweedledee and Tweedledum. She meets the caterpillar, who has this wonderful pipe. Hookah. She meets Cheshire Cat, the nasty queen, Alice. Well, she is Alice. We're all mad around here. And March Hare and Mad Hatter. March Hare is the subject of our movie, and after she wakes up, she finds herself at a tea party.
The March Hare, just like everyone else, is mad in Wonderland. The Hare is best friends with the Mad Hatter and enjoys tea just as much as him. Although they're close, they're both insane. March Hare seems to be a bit more loud, rude, and wild than the Hatter, who is a bit more gentlemanlike. Besides the cat, the March Hare seems to be the only one not to have true fear of the Queen of Hearts, being he is capable of screaming in her face, nothing, whatever. He also tends to start sentences with the ah, typically before making a proclamation.
Would you like to have some tea?
Sure.
Sit down, sit down, sit down. Have some tea, have some tea. Tea? You want tea? Tea.
Thank you.
Tea.
Sure.
Tea.
I have a few questions for you.
Questions?
Yes.
Questions?
What is your name?
Do you know spring is the best time to breed rabbits?
I did not. What day is today?
We're all mad around here. More tea?
No response.
Here's some cream.
Where were you born?
Clean cup! Clean cup, move around, clean cup, move around.
Hey. Where do you live at?
Have you seen Mouse?
Where do you live at?
Mouse doesn't like cats. Cats! Cats! Oh my gosh, don't say cats! Tea? Better have some tea. Oh! We're all mad around here.
Do you have a support system?
Look at that. 2 days late. I told
No,
Hatter
no,
to fix my watch. He didn't fix it.
Are you feeling depressed?
I am not depressed. I have tea. Clean cup. Clean cup. Move around. Clean cup. Move around. Have you seen White Rabbit?
Do you have any fears?
Fears? I only fear running out of tea.
What will you do if there's no more tea?
Still 2 days behind. No more tea. Clean cup. Move around. Clean cup. Move around. Why don't you say what you mean and mean what you say?
I think I did.
I have a great idea. Let's change the subject.
Hey doctor, I wanted to talk to you about a patient. The patient's name is March Hare. He lives in Wonderland. He's orientated to himself, but not to reality. He answers questions both appropriately and inappropriately. He's uncontrollable, loud, rude, and wild. He has repetitive movements and blurts out inappropriate words and also compulsive behavior.
Hi, doctor. I'm Erica, the nurse that observed the interview. For March Hare, my nursing diagnosis was impaired verbal communication related to psychological status. Symptoms: he was loud, rude, and wild during his interactions. My goal for this patient would be he needs to communicate better or his ability will return within a month.
That's appropriate.
Interventions to make sure he reaches his goal would be to assess the patient's communication weekly and record it. Observe the patient closely to anticipate his meds. And then refer the patient to psychiatric nurse, community agencies, and self-help groups. We would do this because resolution of the communication problems may require long-term follow-up.
That sounds good. So based on that, there's a few antipsychotic medications that we could try: the haloperidol, risperidone, or ziprasidone. Based on the fact that he has Tourette's, I think the most appropriate right now would be the haloperidol. Initially, we'll start him off 0.5 to 2 milligrams PO every 8 to 12 hours. And after 24 hours, if it's still severe and the symptoms necessitate it, we can increase it and titrate it up to 3 to 5 milligrams PO every 8 to 12 hours. We'll have you also instruct the patient for relaxation techniques, maybe yoga, meditation, deep breathing. And then we could even do a referral for cognitive behavioral therapy, like EMMH. Want to have him find a qualified therapist, and maybe even suggest talk therapy, where they can find the root of the problem in a controlled environment. I'm going to recommend they do weekly meetings with the psychologist, and then follow up in a month for a recheck. We'll find out how the meds are going, and how treatment is progressing. Any questions?
Okay, so just to make sure, you want me to give 0.5 milligrams PO 8 to 12 hours, and then after 24 hours, 3 to 5 milligrams PO?
If it's necessary.
Okay.
If the behavior is.
Do we need to call you then before we start the 3 to 5?
No, just make sure you document what's going on at that time. That's a standing order.
Okay. And then you said to try some yoga, recommend yoga, meditation?
And deep breathing.
Okay, and then you said cognitive behavior therapy, maybe a qualified therapist.
And I suggested like maybe a referral to EMMH.
Okay. Would you want me to refer him, or are you going to do that?
I would have to write the order for that.
Okay. And then you want to have a follow-up appointment with you in a month?
Yep. Yep.
And then have weekly meetings?
Weekly meetings with the qualified therapist.
Okay.
So that monthly checkup will make sure that that follow-up has been done, that
Okay.
the medications are holding him and the therapy is progressing.
Okay, any recommendations for making sure he stays up with his meds? Because he was saying during the interview he's 2 days behind.
Maybe we could do a calendar organization for him so that he can keep track of the days, or maybe he can have a cup of tea each day for the meds. I mean,
Or have
something that relates to him.
Or have the public health nurse fill a med set for him.
Okay.
I think that would be good, and she could do a weekly check.
Okay.
Thanks, doctor.
Thank you.
I have an excellent idea. Let's change the subject. And that is our presentation of Alice in Wonderland and the March Hare.
Did you ever see an oyster walk? Did you ever hear a turtle talk? Did you ever see a caterpillar puffing on a pipe? Or a mouth with a sail on the tip of its tail? Certain little girl once did.
1, 2, 3, showtime.
Impaired verbal communication. Doctor, I'm Erica. I was the nurse at interview in this situation.
Stop.
Good idea.
Wait a minute.
Cystic chair to
Do you hear those dogs?